Hi everyone and welcome to another episode of Oaktree TV. I'm Dave Kemp and today I'm joined by Dr. Adam Voss. Adam, say hello.
Hey Dave, thanks for having me. Appreciate it.
Absolutely, Adam. Thanks for coming on. So Adam is a clinical audiologist at the University of Washington here in St. Louis. And the reason I wanted to bring him on today was to discuss the PSAP database project that he, Dr. Mike Valente, and Dr. Bankaitis are all working on. So Adam, why don't we start there? Tell us a little bit about yourself, this project that you're working on and how you became involved.
Sure. Well, like Dave said, my name is Adam and I'm an audiologist here at Washington University. I've been here coming up on 2 years now full time and did my undergraduate work down at Mizzou and my graduate training here at Washington University. AU actually approached Mike and myself in my fourth year, so a year and a half ago, about the PSAP study, and we were obviously intrigued, definitely interested in working with her. Her main idea was to evaluate these PSAPs, personal sound amplification products, see how they perform. There's a big rise now on these PSAPs and over-the-counter products, hearing devices, OTCs, things like that. And so we just wanted to see how they did, how they performed, how they held up in comparison to traditional hearing aids, which are the gold standard for treating hearing loss. So her idea was to evaluate them electroacoustically to see how they compared, which was a minor part of the study. The bigger part was to perform real ear measurements on these devices and compare them to hearing aids for 8 different audiometric configurations, anywhere from slight to mild, higher frequency loss, down to more global, moderately severe loss. So that was the purpose of the study. There's laws coming into place to try and create this new over-the-counter regulation for these hearing devices, in that sense, for more mild to moderate hearing losses. So we just wanted to see how that held up. So that was the study. We gathered a lot of data over the past couple years, and I'm excited to share it with you guys.
Yeah, no, that's great. And I think what's cool about this is that, as Adam mentioned, with all of these PSAPs and OTC devices and online devices that we're seeing pop up every single day, the beauty of this project is that it allows for a set of protocols and parameters that allows it to be replicable, so that you can just pop different devices into this and test them throughout the same sort of protocols and see what's good, what's bad, and vet them that way. So let me ask you, Adam, what are some of the main takeaways that you've had thus far?
So we had a lot of great data. And before I go any further, the article actually was published in November edition of Hearing Review. So for the full kind of read there, that's where it's at. But the big takeaways were there are a lot of PSAPs out there, and a lot of them honestly don't do a great job, and then some of them do. And I want to focus on that, where these up and coming laws are focusing more on this mild to moderate category. We found that to be somewhat true. Some of the PSAPs we tested did honestly okay at meeting these prescriptive targets for mild high frequency hearing loss. A lot of them did not. There was a lot of under amplification, especially once the hearing loss got to moderate or greater. A lot actually over amplified some areas, which could potentially be damaging to the patient. So that was a big takeaway, is that there's a lot out there. There's a few devices that do an okay job. So our job, I think, as the provider, is to educate ourselves on what's good, and that's why this database is great, because you can, you have this protocol. You get a new device, put it through the protocol, test it, make sure, see how it works, so that you can then recommend that to patients potentially if they're interested in these PSAPs. But our main takeaway was that PSAPs, the ones we tested at least, again, there are many, were only good at meeting a prescriptive target up to about a mild, higher frequency hearing loss. And that's, again, when we programmed it a little bit ourselves from what we had available. Right out of the box, don't do as good of a job.
Yeah, and I think that, for all of the busy audiologists out there that are watching this, kind of the beauty of this is that this repository that's being built up by people like Adam, by AU, a number of other, Catherine Palmer, I know, a number of other audiologists that are vetting these. We're putting them and logging them in that database. You can find that database on Oaktree Products website. On the homepage, it says PSAP database, kind of up in the top right. But this allows for you to just quickly see, how these things were, how they did and what's good, what's bad, so that you don't need to spend time doing that. You can just quickly understand, what maybe would make sense to incorporate into your practice, which brings me to the next question that I have for you, Adam. Through all this experience, has this impacted your service delivery models, at your place of work?
Definitely. So we've all met, and we have actually implemented pretty recently a new, we call it our PSAP model. We're not dispensing PSAPs per se, but it's a way to get patients, to enter that hearing device world without, the questions. PSAPs are widely variable in how they perform. And rather than have a patient just go online and buy something, and some of them are really cheap, some actually come with a pretty hefty price tag. Rather than them, taking a gamble on those devices and not knowing how long the company will stay in business or where they take it if they have issues, we're implementing an unbundled approach to hearing aids. So it's more of offering a basic entry-level hearing aid to patients at a significantly lower cost than the traditional model. Comes with one visit included, and that's where we do all the real ear measurements, the programming, the fine-tuning, show them how to use it, just to get them, in the door to the hearing aid world without doing it the wrong way. I think a lot of the way patients do well, a lot of that comes from the service. You can get a good device, as if it's not programmed appropriately, you're not going to perform optimally. So just a way that we have decided to do that without patients getting devices randomly online. They can come here, lower cost option, and you're getting this basic hearing aid technology, which our study showed meets targets for up to even a moderately severe hearing loss in most cases. So that's what we've implemented, and it's going well so far, and I think it's just a good way of meeting somewhere in the middle.
Yeah, no, that's really cool, and that's good to know. So it's kind of like understanding what works, and then also how to go about selling those things in a way that isn't super labor intensive or time intensive. So Adam, thank you so much for joining me today. Thank you to everyone who tuned in, and we will see y'all next week. Cheers.
Thanks, Dave. Appreciate it.